Sitting, Community Health Center. You are talking to a 60-year-old woman who is concerned about varicose vein on her left leg, which becomes increasingly itchier. She needs some advice. Now, let's see the task. First one says, find out more about her current condition. Second one says, find out relevant details, general health, underlying health conditions. Third one says, explain venous status dermatitis is the reason for itchiness. Chronic inflammatory skin disease, blood buildup in damaged blood vessels, and eventual leakage or oozing of blood into the skin. Fourth one says, find out any remedies tried, medicated creams or moisturizing lotions. Fifth one says, make recommendations to ease itchiness. Moisturize at least twice in a day, compression stockings. Sixth one says, explain the importance of not scratching. It worsens the itchiness, lead to cuts or infection. Seventh one says, advise the importance of doctor's appointment if symptoms get worse. Last one says, remind various varicose vein management and self-care. Keep active, use loose clothing, avoid sitting or standing for a long time, elevate leg when sitting. Let's get into the roleplay now. You can start the introduction as, hi, good morning, I'm Donna, one of the registered nurses working at this community health center. Please tell me your name and age for documentation. Then interlocutor may respond to saying, very good morning nurse, my name is Madonna and I'm 60 years old. Then responder saying, hi Miss Madonna, may I know what brings you here today? Then interlocutor may respond to saying, nurse, I'm very much worried about the varicose vein on my right leg, which has become more itchy nowadays, so I don't know what to do. Then responder saying, I completely understand your worries, Miss Madonna. Please set your mind at ease. We are here to help you. Would you mind if I examine your leg, please? Then interlocutor may agree with that. Then continue by saying, thank you, Miss Madonna. Based on my examination, I understand that there is an inflammation of varicose vein, but do not be worried. We can manage it effectively with some treatment modalities. Okay, Miss Madonna, before moving ahead, may I ask you some questions in order to understand your condition much better? Then interlocutor may agree with that. Then continue by asking, can you please tell me about your general health? Then interlocutor may tell you like, nurse, I'm healthy as far as I know. I do not have any other medical conditions apart from this. Then ask her, how long have you been experiencing this problem? Then interlocutor may respond by saying, nurse, I've been experiencing this condition for the last 1 year. However, I could see my veins becomes much itchier nowadays. Then respond to her, okay Miss Madonna, can you please let me know how severe it is? Then interlocutor may respond by saying, nurse, initially, almost a year ago, it was not so severe. However, it became unbearable for the last couple of months. Then ask her, alright Miss Madonna, have you ever noticed any issues like swelling or any other problems on your legs? Then interlocutor may respond by saying, yes nurse, I notice some problems when I scratch my skin. That is, it becomes red, swollen, along with pain and burning sensation. I could also see some changes in the skin color around the varicose vein. Then responder saying, thank you Miss Madonna for sharing all those details with me. It helped me to understand your condition much better. First of all, let me explain you what is varicose vein, its causes, symptoms and management. So you can ask me if you have any questions at the end of it. Is it okay with you Miss Madonna? Then interlocutor may agree with that. Then continue by saying, varicose veins are swollen and enlarged veins which usually appears blue and dark purple in color. These usually occur on the lower part of your body, especially legs. Varicose veins itch because of a condition called venous status dermatitis. It is a chronic inflammatory skin disease. It happens when blood accumulates in damaged vessels. It can eventually leak into the skin. Then skin over the veins becomes red and itchy. Now let's see what are the symptoms of varicose vein. There are various symptoms for varicose vein such as burning sensation in the leg, uncomfortable legs that feel heavy or achy, muscle cramps that can be more noticeable at night, swelling of the feet and dry or itchy skin that appears thinner of the varicose vein. Apart from that, occasionally veins very close to the skin may burst. This usually causes minor bleeding. Therefore, it requires medical attention. But do not be worried, Miss Madonna. We have better remedial measures to manage this condition. Are you following me? Then interlocutor may agree with that. Then continue by asking, have you tried any medication before to manage your symptoms? Then interlocutor may tell you like, yes nurse, I was applying a cream once in a day. The responder, okay Miss Madonna, it is a good idea to apply moisturizing creams twice in a day, which helps to reduce your itching and it brings down inflammation of your legs. Moreover, it can help moisturize your skin while it heals. In addition to that, please use compression stockings. Wearing compression stockings or stocks places pressure on the veins in the lower legs. The pressure can help improving the blood circulation and prevent further varicose vein. Compression stockings may also help you to reduce swelling and lower the risk of blood clots in the legs. Apart from that, it helps in reducing pain related to varicose vein. Do you have any questions for me, Miss Madonna? The interlocutor may respond using, yes Miss, I feel like scratching it and I cannot really stop scratching it sometime. Then the responder was saying that, acknowledge your worries Miss Madonna. It is highly important to note that you do not scratch the skin as it leads to worsening of your itching and it may lead to cut sore infection. Instead of that, it is a better idea to make an appointment with your doctor if the symptoms get worse. I hope you're following me. Then interlocutor may agree with that. Then continue by saying, apart from that, I can also suggest you some varicose vein management, self-care and remedies which can be done at home. Is it okay with you, Miss Madonna? Then interlocutor may agree with that. Then the responder was saying, first of all, you can keep yourself active. That is, you can do simple exercises regularly which improves your blood circulation in the legs. And make sure that you're not wearing tight clothes. This can restrict blood flow. You can wear loose clothes instead. It will help to improve blood circulation and reduces the pressure in the leg veins. In addition to that, you can keep the legs elevated ideally at the same height as the heart or above. It will help to improve blood circulation. This reduces the pressure on the leg veins. Please never stand or sit anywhere for a long period of time because it may cause some kind of inflammation on your veins. Are you following me, Miss Madonna? Then interlocutor may agree with that. Then continue by saying, I can also give you a leaflet which contains details regarding the management of varicose vein. You can go through it so that you will get a better idea. If the interlocutor does not have any more questions, you can wind up the roleplay by saying, so far we've discussed about varicose veins, its causes, symptoms and management. I hope you understand that. If you have any more questions or concerns, please feel free to contact me. I'll be glad to help you. Once again, I assure that if you follow these instructions along with medications, definitely you'll get a better improvement and you can lead a normal life. Thank you, Miss Madonna, for your valuable time. I wish you a speedy recovery. Thank you guys. Our roleplay ends here.